from the American Academy of Pediatrics.
Hi, Dr. Edith here. When I was in training to become a pediatrician, I had a really tough case. A quick warning that what I'm about to tell you is pretty sad, but I promise there's a reason I'm sharing this story. I came in one morning and a baby had been admitted to our team overnight after being shaken by one of her caregivers. She was having multiple complications from that, and her parents were so distraught and confused by how this could have happened. Since that experience, I have really tried to have honest conversations with parents in my practice about how hard it is to care for crying babies, how much support we all need, and how we can do our best to pick caregivers that are qualified to care for our little ones. All of which we're talking about today.
It is perfectly okay to set your baby down in a safe space, like their crib, their bassinet, their pack and play, and walk out of the room. Shut the door. They're okay. Crying is not going to hurt your baby.
Welcome to Healthy Children, the podcast for parents from the American Academy of Pediatrics. I'm Dr. Edith Bracho-Sanchez. I am a pediatrician and a mama figuring it out. This is a judgment-free space where all questions are good questions, and the answers will hopefully be even better. Let's get started. Today, we have with us Dr. Natalie Kissoon, who is a clinical associate professor in the Department of Pediatrics at UT Health San Antonio, and we are talking about a tough topic, abusive head trauma. Natalie, welcome.
Thank you so much for having me.
Natalie, I think the name is pretty self-explanatory, but I want to make sure that we all know exactly what we're talking about. So, what is abusive head trauma?
Abusive head trauma is an injury to the skull or the intracranial contents of an infant or young child less than 5 years of age due to inflicted blunt impact and or violent shaking.
All of the words are just so hard, right, to hear, and even the description of it. Natalie, what is the most common way that this happens?
Often, the stories that we hear is that a child was crying and a caregiver becomes frustrated and that they're not able to calm that baby. And out of that frustration, they shake the baby or throw the baby, causing the head injury.
Gosh. And I want to talk to you about prevention, Natalie, which is the reason we're having this conversation in the first place. But to sort of wrap up this medical understanding of what this is, what are the long-term consequences of suffering from abusive head trauma?
Most children who have abusive head trauma have some sort of disability. It can range from the need to have a trach to help them breathe, a G-tube to help them eat, not being able to see, not being able to move on their own, so never being able to sit up, to crawl, to walk, to run, to jump. Or it can be having cognitive delays and learning disabilities, despite the fact that they're able to do all those other things on their own.
And again, the hope with us describing all of this, which is really hard to hear, right? And I think all of us think, never me, never my child, this is never going to happen. But I think when we talk about prevention, it is so important that we look at it, what I like to say is as the potential layers that are needed to prevent different things, in this case, abusive head trauma. So tell us a little bit about those layers. Again, understanding that probably everyone listening at home is a little bit distraught by what we just described, right? So let's switch over to prevention. What are those layers? How do you think about preventing abusive head trauma?
One of the first things that we need to do is provide education. So education to caregivers about the harm of shaking or throwing a baby or causing impact to the head. The other education we can give is about how babies cry and what are some of the things that we can do to soothe a baby. But I think going along with that is that sometimes, despite all of our best efforts, we can't soothe a baby, and that's okay. We also want to recognize that a crying baby is really, really hard. I sometimes joke with my families that when I'm in the office and I hear a baby crying, as they so often do when they come to the pediatrician's office, I think it's really cute. It doesn't bother me. Sometimes I'm sitting in my office and I don't even hear that that's going on. Versus when my daughter was little, when she cried, my goodness, did that bother me?
Yeah.
It seemed to like, when you have something in your teeth and it's like hurting, like it was really intense to hear her crying. And it was even worse when me, her mom, who's supposed to be able to help her, take care of her, was not able to stop that crying. And so I think we need to provide education that sometimes that happens and that's okay. Yeah. And that we're going to get frustrated and that's okay. But it's what we do next is what's really important.
Natalie, I have to tell you, I became a mom after I had been a pediatrician for a couple of years. I knew that babies were supposed to cry. I knew how much they were supposed to cry. And when my baby cried, it just completely overrode all of my ability to think or do anything really. I mean, it's really biologically meant to make you stop what you're doing and care for them, right? And I don't think I understood just how strong that biology is and how overwhelming it can be to hear your baby cry. So I'm curious to know, what do you tell moms to do in those moments? Because they're going to happen, right? I think the first step, absolutely. I totally agree with you, is we need to get real and say this is going to happen.
Yes,
now,
absolutely.
What do you do?
Yeah. So when you feel like that, when you feel like you've done everything you can and you feel your emotions are rising, and when you get into that state, you're not going to be able to help either because your baby is now feeling your increased emotions and it's going to be much harder for them to calm down too. So it is perfectly okay to set your baby down in a safe space, like their crib, their bassinet, their pack and play, and walk out of the room. Shut the door. They're okay. Crying is not going to hurt your baby. And then take some deep breaths. If you have to walk around for 5 or 10 minutes, whatever it is you need to do to calm yourself, and then get ready to go back in and, smooch on your baby and snuggle with your baby again. And you can do that as many times as you need to until you guys reach a steady place.
Yeah. I have to tell you, I always thought I have to respond right away because otherwise my baby is going to think that I don't care or the bond is going to be disrupted. And with time, I learned he doesn't care if I take 2 or 3 minutes, right? I still went back. I still picked him up. I still cuddled him. And I had this moment, Natalie, that I'll tell you about and I'll share with our audience. I think he might have been 5 months, 6 months. I can't remember. I just started crying with him. And I thought I would never do that, but I did. I started crying with him and this fascinating thing happened. I put him against my chest and I was sobbing. He was sobbing and slowly our sobs got slower, right? And we both calmed down together. And I think sometimes we forget that we are an entity, right? As moms and babies in many ways. And that's okay, right?
Yes. Yes. I'm surprised that only happened to you one time.
Oh, it's happened more times since
I had
then.
so many times where I was like, it's okay. We're all going to be okay.
It's a real moment, I think. You remember the first time it happens best, but no, it has definitely happened again since then, Natalie, I'll be honest. Yes. Now, the other thing I wanted to ask you about, we focus a lot on giving moms skills and tools and normalizing some of these things, which is, of course, so important. But I don't want to lose sight of everyone around mom, right?
Absolutely.
What can everyone else do around mom and around new parents to support them in this stage of life?
I think one of the first things is we need to get this idea that mom's the only one who can take care of this baby. Just put that away, right? I think if we're thinking about caring for a child, an infant, if breastfeeding is happening, that is probably the only job, definitely the only job that a mother has to do. And as the baby gets older, there's opportunities for pumping and feeding with a bottle that someone else can do. But everything else with taking care of a baby, any other adult in that child's life is capable of doing that. And I think we need to promote this idea that it's not just mom's job to take care of this child. It's everybody's job because this baby belongs to this entire family. So we want to educate other family members to provide that support, especially early on when everybody's really tired and the baby's not sleeping through the night and we're trying to figure it all out. I think it's important that we support the idea that you're still a good mom if you let someone else put your baby to bed. You're still a good mom if you let someone else change all the diapers. You're still a good mom if you don't do all the other stuff that goes along and you're just breastfeeding. I mean, just breastfeeding, right?
Which is a full-time job. Yeah.
Yes, exactly.
Yeah. And there's really, it's something I think you learn with time and motherhood. There's no trophies handed out for most number of diapers changed, right?
Right.
So absolutely room for support there. Now, say I want to be a good friend, right? Say that my friend just had a baby and I want to show up in ways that are meaningful and actually helpful to her and to this baby and to this family. What can I do, Natalie?
The first thing you can do is talk to your friend about what they're feeling and what they're going through and see if they have anything that they want from you that they can vocalize. The other thing is be present and observe and see the places that you can actually step in and help. Sometimes I think it's really hard for people to say that they need help or even recognize that they need help, especially when you're in the middle of something like this. Taking care of a baby, you're just sort of in the weeds of, feed the baby, put the baby to bed, change the diaper. You can't really focus on anything else. And so being there, seeing the things that they need help with, doing the dishes, doing the laundry, taking the baby so mom can go take a bath, take a walk, go run an errand in between breastfeeding or feeding the baby, things like that to really give them a sense that they're not in this alone and someone is there to take over, to help if they need it.
Yeah, I love that. And I have to tell you, I was one that took a long time to ask for help. And that is something I would definitely do differently if I could go back, right? Natalie, I want to also ask you about picking caregivers and returning a little bit to our conversation about safety. I know this is a loaded question and we could probably have a whole episode on this, but when it comes to safety, what are the things you recommend we look for in a caregiver? And I'd love for you to tell us about both nannies and daycare centers because every family situation, of course, is different.
Yes. Number one, when you're choosing someone to take care of your child, no matter what age, is make sure they actually want to take care of your child. That they're not doing it because they're a last resort and they're like, okay, I'll help you out. Because if they don't want to, they're not going to put themselves into it the way that you need them to when it comes to taking care of children and especially infants.
Yeah.
The next thing is to make sure that they are educated on how to properly care for infants. So, what is the feeding schedule? Be very specific. How much? How to make a bottle? Where does the baby sleep? How does the baby sleep? How to dress the baby? How to change a diaper? So you need to make sure they can do all of the things that that child needs for their care and don't take it for granted. Oh, they already have children, so they know what to do. Oh, they've read a few books, so they know what to do. You need to make sure that they actually know what to do for your child because every child is different and have different requirements. And you want to make sure they know what you specifically need, what soothes your child the best, how they eat the best, what bottles they like, how they like their formula, all of those things. And if you go over all those steps, then you know that you've done all you can to ensure that they're giving your child the best care that they can.
Yeah, so important.
I think when it comes to nannies and daycares, it's really hard because there are so many families who are low resourced and their choices are limited.
Yes.
And that's a really hard thing because they are really trying to do the best that they can with the resources that they have. Again, starting off with making sure that person wants to take care of your child and knows how to take care of your child is always the best framework to go to. If you're using a nanny or an agency, making sure that you're finding them through channels that are actually checking who they are, what they do, that they're capable of, that they have the appropriate training that they need to be childcare. If it's a daycare center, make sure they're licensed. All of the childcare licensing agencies in all the states have websites you can go to and look up a daycare to see if there have been complaints or if there have been problems at that daycare. So taking that opportunity to do that next step is really important.
Yeah, I love that. And I have to tell you, it's not something that I really thought about so thoroughly until I was looking myself, right? And it's taking that time to communicate, to look up, right? To use established channels to the best of our abilities. Because as you said, the cost of daycare and childcare in general in this country is insanity right now. So our choices are sometimes limited and we do need to acknowledge that. But to the best of our ability, just taking those additional steps to communicate and make sure the person's qualified. Natalie, I have to tell you, I have really enjoyed our conversation, really with this focus on support and prevention, knowing, of course, how scary abusive head trauma or the thought that it could happen to any child around us can be, right? As we come to the end of our show, we do like to end our episodes with what we call a parenting prescription. So when it comes to preventing abusive head trauma, what is one thing you want all parents to know?
That it is okay to walk away from your crying baby.
I love it. Simple and clear. Thank you so much, Dr. Natalie Kissoon, for joining us today.
Thank you for having me.
And thank you at home for joining us. If you like the Healthy Children podcast, please subscribe on your favorite podcast app and help us spread the word. Follow Healthy Children on YouTube, Instagram, Facebook, and Threads at Healthy Children AAP. And be sure to visit healthychildren.org, the parenting website of the American Academy of Pediatrics. Healthy Children is a production of the American Academy of Pediatrics. Our creative team includes
Laura Alessio,
Catherine Beard,
Garrett Brown,
Zach Christman,
Ann Johnsos, Kathy Jewell,
Claire Keating,
Doug Nagel,
Jackie Ortega, Susan Stevens Martin,
Mary Claire Walsh,
Hannah Weston.
And our theme music was composed by Doug Nagel. We'll be back next week. I'm Dr. Edith Bracho-Sanchez. Thanks for listening.